Hi, and thank you for joining us. My name is Dr. Erin Toth. I'm a pediatrician and a parent of a Springfield Catholic School student. I'm joined here today by several other physician parents to discuss COVID-19 vaccination. Sister Cecilia Ann has graciously allowed us to offer this information and education to our families, but to be clear, we are not a decision-making body for the school system. She has helped us gather questions from the school community about COVID-19 and vaccinations, and this is what we are planning to discuss. If you sent in a question that is not addressed this evening, it's fallen outside the scope of our discussion. Thank you again, and I'm going to hand things over to Dr. Chris Mulligan.
Hi, my name is Dr. Christina Mulligan. I'm also a pediatrician for Cox Health, and I am also a Springfield Catholic parent. And so I am here to give a little bit of information about COVID infections in kids, and also vaccination. Being a pediatrician, vaccination is a big part of what has been my practice for 12 years now. And so I would like to share a little bit of information with you about the COVID vaccine specifically, and then we also have some questions towards the end that will be addressed by some of our other physician parents within the Catholic school system. So why are we doing this again this year? Well, starting off a little bit, I want to touch on the Delta variant. Of course, we're all very familiar with COVID-19. We've been dealing with this for coming up on 2 years, but things changed a little bit over the summer with the Delta variant landing in Springfield, Missouri. What we know is that the Delta variant is continuing to spread in the United States. It accounts for over 90% of COVID cases in our region, as well as across the country now. It has been higher in our region due to lower vaccination rates. We do have lower COVID vaccine rates in our community than the nationwide average. And we also know that the Delta variant is more serious, it's more contagious, and it's causing more significant illness. What are we seeing with the Delta variant? Well, we know that our patients are younger and that they're sicker. The average age of patients hospitalized at Cox Health has dropped significantly. In the most recent communication we got, it's down below 63 years of age, below 63, average age for people hospitalized with COVID-19. The symptoms are starting sooner. There's less of a lag time between when people are infected and when they start to show those symptoms. And we're now unfortunately seeing people between the ages of 20 or 40 regularly hospitalized. Of course, it's tragic when anyone of any age is hospitalized, but especially these young, healthy people who weren't necessarily expecting to be at risk, we're finding are being hospitalized at a much higher rate. Fatality is just one measure of how COVID-19 affects people. We also know that people, once they recover, are at significant risk of having serious problems in the long term. Things like needing oxygen, limitation to their physical abilities, and chronic symptoms that don't necessarily go away even when they get over the acute phase of illness. It also is affecting kids more. So this statistic comes from the American Academy of Pediatrics. They've been tracking COVID cases in kids since it all started last spring. And what we're seeing is that Delta is as much as 2.5 times more transmissible in kids. So last year when we were dealing with COVID, I saw some of my pediatric patients get sick. Usually it was when members of their household were also sick, but what we're seeing now is much more spread between children, spread in the classroom setting, and we're seeing higher rates of pediatric COVID-19 infections. You can see as the number of cases of the Delta variant goes up in adults, a much higher percentage of those cases are being made up of kids. In fact, about 22% of cases diagnosed currently across the country are pediatric cases of COVID-19. How can we keep our kids safe? We all know that our kids do better when they're at school. How can we keep them safe from this disease, but also keep them together in large groups in our schools? Well, the American Academy of Pediatrics updated its recommendations for opening schools this fall. What we know is that our kids do better when they're in the classroom setting, and so the AAP worked very hard to kind of put together this list of guidelines for schools when they're looking to opening. The recommendations can basically be boiled down to all eligible individuals should be vaccinated if they are old enough. That includes students, that includes staff, teachers, anyone who can. All students older than 2 years of age and all staff should wear face masks, regardless of their vaccination status, because we know that that will greatly decrease the transmission of COVID-19 in the school system. They have recommendations for good cleaning and maintaining adequate ventilation. All of that was outlined. And then, of course, they also recommend testing as much as is necessary and then quarantining when needed. Now, why the need for all of these measures if we have vaccines or if the kids are masking? Well, it's because what we know is that none of these measures are perfect. And so we call this kind of our Swiss cheese model of protection. And what it means is that each one of these individual layers that we use, whether it be the physical distancing, the hand hygiene, the masking, all of them help cut down, but don't completely eliminate transmission. But the more you stack those layers together, the more you eliminate those holes, the better it helps protect us from spreading that disease. So the more we can all work together to build out these layers, the more it will help keep all of our children safe in the school setting. To reinforce that point, something that happened relatively recently, the Children's Hospital Association for the country came together and actually posted an advertisement in the New York Times as well as the Los Angeles Times. They all came together and issued a letter asking for public leaders and for communities to vaccinate their children, any adults, as much as they can, and also recommending that everybody should be masking while they're at school and that all schools should adhere to safe practices of social distancing and hand washing. And you can see, and I didn't even include the whole list, but it was a full-page ad that was featured because we're seeing so much more COVID-19 in kids. We're seeing so many more kids hospitalized, especially when you put that on top of the different RSV pandemic that we've been dealing with. Our children's hospitals are really in a tight spot, and they're asking us for help. Is masking harmful for children? Of course, this isn't something which is normal, right? We don't all walk around wearing masks. This isn't something which within our culture is something that we do a lot. And so this is something that different individuals have looked at, and what the American Academy of Pediatrics data says is no. There's no evidence that it's harmful to a child's speech, language development, or social emotional development. There are special masks that are clear, that our teachers can use, that we can give to our children as well so they can see facial expressions. They're interacting with their friends outside. They're interacting with their family members at home without masks on. There are plenty of opportunities for that kind of recognition of facial expressions. And remember also, most kids have a solid foundation of that language development and interpreting emotions well before they enter kindergarten or preschool. That foundation is set really in those first 2 years. So no, there's no evidence that masking is harmful to a child's speech or language development or their social emotional development. There's no evidence that it weakens the immune system. We're going to elaborate that a little bit more when Dr. Bill Micka, our immunologist, talks a little bit. It does not lead to breathing problems or lung problems. Patients with asthma and underlying health problems can mask easily and safely. And again, all that information comes from the American Academy of Pediatrics. How can we help keep our children safe? Again, reiterating the importance of masking. This study was actually released in the MMWR, an infectious disease journal that's issued weekly by the CDC. And what it was a case report of what happened in one classroom setting where the teacher was masked, but she would take down her mask every time she was reading a story out loud to the classroom setting. That teacher worked for 2 days before becoming symptomatic with COVID-19 infection. And what they found was that in her classroom of 24 students, 12 of those children tested positive for COVID-19 within a week of that teacher testing positive and notifying them. The attack rate for children in those first 2 rows closest to the teacher's desk was 80%. So with that teacher working for 2 days, occasionally taking down her mask to read stories out loud, 80% of those children in those first 2 rows developed COVID-19. So again, we know that masking greatly helps cut down on the risk of COVID transmission, and it's going to be important to help keep our kids in these classrooms safely. How do the vaccines work? So vaccine is, of course, another layer of protection that we offer. Some people have a lot of questions about the vaccines. They're new. It's new science or technology. So I have put together just a little bit of information here about the messenger RNA vaccine. So a brief crash course in molecular biology. I was always a science nerd in high school and college, so this kind of stuff I think is pretty cool. So RNA, which is what those vaccines have pieces of in them, that's ribonucleic acid, versus DNA, which is what your genetic material is within your nucleus, right? So that's deoxyribonucleic acid. Some people will say, well, doesn't this vaccine contain genetic material? Couldn't it change my DNA? Well, the answer is no, it couldn't. They're actually chemically very different structures. They have a different sugar in the ribose or deoxyribose. They've got different chemical compounds that make up the different bases. So they're not interchangeable. So it's important to understand that basic piece to know that that RNA is in no way, shape, or form related to your DNA, and it's not going to do anything to damage or affect it. The DNA lives within the nucleus of the cell, and it holds the blueprints for construction of those proteins, versus the RNA, which is a much smaller structure that has a variety of functions But specifically, messenger RNA is responsible for carrying that blueprint coded by the DNA out into the cytoplasm of the cell, the business place in the cell where all those proteins are made, and that's where those proteins are going to be constructed. Important to clarify, this is only talking about the Pfizer and the Moderna vaccines, which are the messenger RNA vaccines. So what happens? Well, you get your injection with the messenger RNA. The messenger RNA is in this fatty capsule, which helps to gain entry into your cell, where the messenger RNA is then taken up, and then your body's protein-making machinery, the ribosomes, actually will read that blueprint and start making these spike proteins, which will then get presented within your body on the surface of those cells so that your body's immune system here can start manufacturing antibodies. It can activate your T cell response, and it's kind of like training for an immune system. I kind of talk to people about vaccination as being like you wouldn't stand up off of your couch and go run a marathon having never run before, right? If you try to fight off one of these diseases, having never had the shot, it's basically like trying to go run that marathon without having the training. This vaccination is like the marathon training. It's going to give your body time and training and how to fight this disease, just like a marathon runner would be putting in weeks and months of work, so that when the time comes and it's asked to pass that big test of fighting off that infection, it's going to be able to do so. What are the side effects of the vaccine that we know of? Basic flu-like symptoms are going to be normal: fever, headache, nausea, vomiting, chills, body aches, fatigues, your shoulder's going to feel a little bit sore. These symptoms are typically going to last about 24 to 48 hours, occasionally longer, but not very often. Serious allergic reaction can be a side effect, but out of 100,000 doses administered at Cox Health, where I work, only one person required hospitalization, and they were quickly discharged home after treatment. No long-term side effects of the vaccine. Serious after vaccine reactions have been seen. There are some rare but serious side effects. Nothing is side effect free. So some of these you may have heard of in the news. So myocarditis, or inflammation around the heart, is one side effect that we have rarely seen with the messenger RNA vaccines, particularly in young men between the ages of 16 and 29. We know that happens at a rate of about 40.6 per 1 million doses given. There were no deaths in that group. Most of them were able to be treated with something called NSAIDs, which is basically like ibuprofen, and had complete resolution of their symptoms after a few days. Surveillance of those individuals is ongoing to see if they have any long-term effects, but to date none have been reported. Symptoms are most commonly going to occur 2 to 3 days after that second dose. But again, 40.6 per 1 million doses given is the frequency on that. Blood clots is another side effect that's been seen with the Johnson & Johnson vaccine. Carries the rare risk of thrombotic thrombocytopenia syndrome. That's associated with low platelet counts in your bloodstream, as well as with some clotting. That one occurs mostly in women between the ages of 18 and 59. 15 cases per 6.8 million doses given is what's been reported so far. So given this information and given those numbers, the overwhelming consensus of the scientific community is that the risk of both the myocarditis and the blood clots is far higher with natural COVID-19 disease than it is with the vaccine. What that means is that if you don't get the shot and if you do get COVID, your risk of having either of these two things happen to you is significantly higher. Why should I get the COVID shot if I can still get COVID after being vaccinated? Some people will say, well, we know that it's not perfect. We know that you can still get sick, so why should you bother? Well, we know that individuals who are vaccinated can still develop symptoms and still spread the virus, but they are much less likely to be hospitalized and die of COVID-19 infection. On average, at Cox and Mercy, about 90 to 95% of those hospitalized are unvaccinated. The claims that these hospitals are full, that they're going on diversion because they're full of vaccinated people, are just simply not true. That is not what our physicians on the ground have been saying within our hospitals. The analogy that I always use for people is seatbelts. You know, do you buckle your seatbelt when you get in the car? You can still be killed in a car accident even if you're wearing your seatbelt, but that doesn't mean that you don't buckle it. You're going to be much better off in that car accident if you're wearing your seatbelt as opposed to if you're unbuckled. Same thing with the COVID vaccine. You're going to be much better off if you get COVID if you've had your vaccine as opposed to if you're unimmunized. But weren't the vaccines developed so fast? Well, the messenger RNA vaccines, such as the Pfizer and the Moderna vaccines, were actually being researched for years. Prior to the COVID-19 pandemic, they were looking at them, trying to see if they could be useful for vaccinating against other diseases in the world. But once the COVID-19 pandemic hit and once that virus was sequenced in China, they were ready to begin their trials. They had the technology ready to go. They were just looking for an opportunity to use it. Phase 1, 2, and 3 clinical trials were all completed to ensure both safety and efficacy of the vaccines. For non-live viral vaccines, side effects typically show up within 2 months of vaccination. We're much further out than that now with our COVID vaccine database. There's been very, very few serious side effects reported with millions and millions of doses being given. So we're learning, and what we're seeing is that these are actually some of the safest vaccines that we've given. The only part of the process that was cut short with the research and development was determining how long the vaccines would last. So usually when these vaccines are released to market, we'll say, okay, well, you're going to need a dose, and then 6 months later, another dose, and then 2 years later, you might need another booster. But we didn't really have the luxury of time to wait and see how long our immunity would last with these vaccines. So they were rolled out, knowing that we would continue to monitor that information while the pandemic was ongoing to see what, if any, doses would be needed down the road. Booster doses are now going to be recommended, or are recommended, I should say, for immunocompromised individuals who meet very specific criteria 6 months after that second dose. Booster doses may soon be recommended, probably will be recommended for otherwise healthy individuals with no immune compromise. We're still waiting on those official recommendations to come out, but we should have them within the next month. So there probably will be some booster doses. How often or how many, that's the part that we still just don't know. Switching gears now to the panel questions. And so the first person that I would like to introduce is Dr. Mitch Ahrens. Dr. Ahrens is a pulmonary critical care specialist with Cox Health. He's working in the COVID units. And so the questions that were submitted that we've asked him to address for us: why do we have to do all of this? Isn't COVID just like the flu? Why is the Delta variant affecting our individuals, and do we need to be concerned about additional variants? And so I'm going to turn it over to him to talk a little bit about his experience on the COVID floors and what he's been seeing. Dr. Ahrens, I'll let you come on.
Hi, I'm Dr. Mitchell Ahrens. I'm one of the pulmonary and critical care doctors at Cox Health. I've been rotating through our COVID ICU since last year. It's been quite an experience that I'd never thought I would ever experience or could even imagine at this point. But as to the first question, whether this is sort of like the flu, this has been sort of, we do see cases of flu very similar to what we're seeing here, but this has been really kind of worst flu season on steroids to some degree. I'll see people with influenza get very sick, wind up on life support, on breathing machines and everything else. But this experience has certainly been a lot more cases. I think last year, anecdotally, we hardly had any influenza cases, and I think part of that is related to all the measures that we had in place. Worst case scenario with influenza, you do wind up on life support. We've had some immunity to influenza before with getting it in previous years, but this virus is something that our bodies have never seen. And so I think we basically see a lot more cases just because of the sheer numbers, and also it seems to be just more severe as far as the inflammatory reaction within the lungs, and as well as heart and kidneys and all the other organs in the body that we see. And so it's certainly been eye-opening to really experience all this, and certainly has changed my perspective on a lot of things. As far as the Delta variant, I think I had the opportunity earlier this year, as the cases waned down our COVID ICU at Cox. We actually got our case number down enough that I was able to shut that unit down. A few weeks later, the case number started rising, and we started having more and more very ill patients. And we've had to open it back up and haven't been able to get our numbers down to close it down again. I think the first round affected a lot of the older patients more, just because they have typically more illnesses to start with. I think they've been vaccinated to a much more degree at this point, and so over the past year I've seen 18-year-olds to 102-year-old in our ICU. What I'm seeing right now is really the younger population that's well under 60. We have 20-year-olds, 30-year-olds, 40-year-olds, 50s, 60s. We still have 70s, 80s, and a few 90-year-olds that are in our ICU that I've seen here in the last few months. but by and large, it's certainly been a much younger population at this point. As far as additional variants, there's variants out there right now. They're looking at Mu, I believe, at this point, as a variant of concern or interest, actually. And I think a lot of that is probably natural selection of the virus. Is there's thousands of people being infected, and over time mutations will accumulate. Some are good for the virus and make it more virulent. Some are less so, and those variants aren't seen. But I think it really comes down to a math number of over time. If there's a lot of people that are ill, we'll see more and more variants. And so hopefully the vaccines that are available will be able to cover those as well. The vaccines that are available now, even though they may not be quite as effective as the original variant, still have very good efficacy and work very well against the Delta variant. By and large, of all the patients that I've had in the ICU, very few have actually had or not been vaccinated and wind up very ill, needing life support. The ones that I have seen have been ill to start with, and even though they were vaccinated, still became ill. But the vast majority, well over 95% of what I've dealt with at this point, has been the unvaccinated population. So that's why, to me, it was a no-brainer for me to get my vaccine. This is something I'll see every day, and I tend to see the worst-case scenario, but I don't think it's anything that's going to go away. And for my personal safety, I felt that I was much better off having the vaccine. Hopefully it will provide protection for the future as well if we get more variants. And our next question, I believe, is going to be fielded by Dr. Mary Duff.
Hello, good evening, and thank you for tuning in. I'm an OBGYN and have dedicated my life to helping protect the lives of and safety of pregnant women and their children. I am thankfully vaccinated myself. I very much want to have grandchildren one day, and I can proudly attest that as soon as my almost 21-year-old daughter, 19-year-old daughter, and 14, almost 15-year-old daughter became eligible to receive the vaccine, they were first in line. This concern about fertility is simply unfounded. It traces back to a theoretical, so there is a protein that exists in the placenta, and there is a very minute segment of protein that's similar in the spike protein of COVID. So it was important for researchers to look to determine if COVID would more aggressively attack the placenta, and unfortunately we are seeing that. We are seeing that the virus is causing placental pathology, causing adverse pregnancy outcomes, and is dangerous to pregnant women and their offspring. I've personally had to care for adverse pregnancy events. I've personally seen the live type virus cause illness resulting in miscarriage, and so fetal loss and severe illness for pregnant patients requiring premature delivery, putting tiny babies in the NICU so that we could save the life of the mother. So I've witnessed the devastation firsthand of this common cold that's unfortunately not so common and is negatively impacting patients. So we do know there is concern with regard to placental health when people receive the wild type virus, and so it was very reasonable to be concerned, would the vaccine also cause some concern or cause women to create antibodies so that they couldn't develop a healthy placenta in the future? And that is absolutely not true. A sub-analysis of the Pfizer data looking at vaccinated women and they're placebo-controlled, there was actually a slightly higher conception and pregnancy rate in the vaccinated individuals. Over 350 million patients have been vaccinated here in the United States, and there has been absolutely no fall off in fertility. The American College of Obstetrics and Gynecology, the American Society for Reproductive Medicine, and the Society for Maternal Fetal Medicine have issued a joint statement to address this concern. There has been no loss of fertility reported amongst trial participants or among the millions of women who have received the vaccine since they were authorized, and there are no signs of infertility that have appeared in the predating animal studies prior to it being approved. So this has been my life's passion, and again, the passion of hundreds of thousands of OBGYNs, reproductive medicine specialists, and maternal fetal medicine specialists. So absolutely, you can rest assured that your daughters can safely receive the vaccine with no ill harm for their fertility in the future. And the next question is, if you're pregnant or breastfeeding, should you get the vaccine? And absolutely, the answer is yes. They've also specifically looked at breast milk, looking at breastfeeding patients, breastfeeding women who receive the vaccine. They've studied breast milk aliquots to determine if there's any particles picked up in the breast milk following vaccination, and no aliquots of the viral particles were evident in the breast milk. But blessedly, there is immunity, there is antibodies eventually passed on. After the woman creates antibodies, she does pass those on to help provide protection for her newborn infant. Next up, sorry.
Thank you so much, Dr. Duff. For our next panel questions, we're going to switch gears. We're going to have Dr. William Micka, who's our allergist and immunologist, and he's going to be talking about allergic reactions and the immunology of the vaccine.
Thank you. So, first question, I have a history of severe allergies. Should I be concerned about getting the vaccine? So, allergic reactions can occur to the COVID vaccine, can occur with every vaccine. The rate, as Dr. Mulligan pointed out earlier in the talk, the rate for allergic reactions is approximately 1 in 100,000 vaccines given. And this is pretty similar to the rate that we see with other vaccines, such as the influenza shot. So allergic reactions can occur. However, that is a very low rate, and it is infrequent. And allergic reactions to vaccines, as with all medications, are completely treatable and 100% reversible, unlike the potential complications that can occur with COVID. Often I get asked the question, if I have allergies to other things, for instance, if I have food allergies or environmental allergies or other medication allergies, am I at an increased risk for having an allergic reaction to the vaccine? And the answer is no. There's no evidence that having an allergic reaction to any of those other agents puts you at an increased risk for having an allergic reaction to the COVID vaccine. The majority of the allergic reactions that have been seen to the COVID vaccine can be traced back to an allergy to an additive of something called polyethylene glycol, or PEG. This is an additive occasionally added to vaccines as a stabilizing agent. And very infrequently, people can become allergic to polyethylene glycol. So only in the circumstance if you have a known history of an allergy to PEG, or if you had a previous allergic reaction to the COVID vaccine, those would be the only medical history, allergic history, that would raise a red flag for receiving the vaccine. Otherwise, all other individuals can and should safely be vaccinated, even if they have multiple allergies. So the answer is yes, you should get the vaccine. You do not need to be overly concerned about having an allergic reaction to the vaccine if you do have other allergies. The second question, is there a benefit to getting the vaccine if we have already had COVID infection? So yes, there is a benefit. Having had COVID infection will give you some immune protection for a time to COVID. That's the way the immune system works. However, that immunity, as with all immune responses, does gradually lessen over time. And there's evidence that, and we see this, where individuals who've had COVID once can obtain the infection a second time. And it can be severe the second time. The vaccine, even if you've had COVID before, still works to boost your immune system and provide you additional protection. There's a study recently published that showed that individuals who have had COVID in the past and are vaccinated have a very strong, robust, both antibody and what's called a T-cell immune response to the virus that provides them substantial protection for both getting the infection and also having asymptomatic infection to transmit it to others. So the recommendation is, even if you have had COVID before, that you still receive vaccination. It still provides you additional benefit and helps lessen the risk for a second infection, helps lessen the risk for you passing the infection on if you were to obtain it to others. The third question, is there concern that all these sanitation practices will weaken our body's ability to fight infection? There's no evidence for that. So the steps that we're taking to reduce COVID, to wear masks to help prevent the transmission of the virus, to socially distance, and then of course the vaccine. All of those things help prevent COVID transmission. Our immune system still, every day, has plenty of opportunity for exposure to other types of bacteria and germs that will so-called strengthen the immune system. By any means possible, we want to prevent infections that will make us sick. That doesn't mean that we live in a completely sterile environment. Wearing a mask will not prevent us from being exposed to other things. But it does help prevent COVID infection. The data on that is absolutely clear. And at this time, with high rates of COVID in our community, it's crucial that we do what we can to help reduce infection rates and reduce transmission to others, particularly vulnerable people. And so vaccination and masking are two things that we know are very effective for that. And there's no evidence that doing those things will reduce our body's ability to fight other infections. Remember, a vaccination is basically, as Dr. Mollering alluded to earlier, is basically a training regimen for your immune system. When you receive a vaccination, it exposes your body to a protein in the virus that later helps us when we encounter it to fight the infection quicker, so that we're not starting off from square one when we're exposed. And unfortunately, COVID is not going away anytime soon. We all will be exposed at some point, and getting the vaccination is our best way to protect ourselves and our loved ones when we are exposed at some point in the future. So I absolutely strongly recommend vaccination. I have a 14-year-old and a 16-year-old, and they were both vaccinated as early as they possibly could. And I recommend it to all my patients with allergies and without allergies to get vaccinated if they're eligible over the age of 12. So from an allergy standpoint, I absolutely do not have any concerns about the vaccine. And next we have Father Lewis.
Oh, lovely. There we go. Does the Catholic Church support vaccines against COVID-19? And I thought what I would do is just give you the statement from the National Conference of Catholic Bishops of the United States. This is a total of the bishops of the United States whenever they come together to make a joint statement. With regard to both the Pfizer and the Molten vaccines, they concluded, in view of the gravity of the current pandemic, the lack of availability of alternate vaccines, the reasons to accept the new COVID-19 vaccines from Pfizer and Molten are sufficiently serious to justify their use despite their remote connection to morally compromised cell lines. Receiving one of these COVID-19 vaccines ought to be understood as an act of charity toward other members of our community. In this way, being vaccinated safely against COVID-19 should be considered as an act of love of our neighbor, part of our moral responsibility for the common good. The other statement that I wanted to bring forth was the Holy Father himself. On August the 18th, Pope Francis on Wednesday urged unvaccinated people worldwide to get inoculated against COVID-19, saying that receiving the vaccine is an act of love, the quickest way to end the pandemic. In a video message, the Holy Father praised the work of the researchers and the scientists in producing safe and effective vaccines. He also went on to say, receiving the shot is the easiest, the most direct way to put an end to the coronavirus crisis, which has been going on for more than a year and a half. It's simple, profound way of promoting the common good, caring for each other, especially the most vulnerable. And I pray to God that everyone may contribute their small grain of sand, their own small gesture of love. And that's the Church's stance, is that we're protecting ourselves, yes, but we're protecting others out of love. Not so much looking at ourselves and me, myself, and I, but the need of the community at large. Our young people, our medium-aged people, our older people, that we are looking out for them. And it's going to take each and every one of us to do that. I received the vaccine in January as soon as it was available. From the Chancery, we got a phone call. That afternoon, both Father Allen and myself received our vaccine. The bishop a couple of days later. I won't say 100% of our priests of the diocese, because I'm sure there's someone, I never make blanket statements. There's always someone that doesn't do something. But all of our priests that I know of are vaccinated.
Thank you very much, Father Lewis, and thank you to the other members of our panel. A few more questions that were submitted. What criteria will be used to decide when the mask mandate will be lifted? Our school system is keeping in close contact with local health officials. There's no clear timeline for that, but what is guiding our best practices is what is going to keep our kids healthy and in school. So when local health officials have decided that those parameters are met, that our kids can be kept in school safely, then that is something that will be reviewed. But the most important thing is for us to be able to keep our kids in school. You know, families having to quarantine, especially when there's two people working, the adverse effect it has on our kids and their social interactions, their learning. You know, our schools work very hard on virtual learning, but it's still not the same as them being able to be in the classroom with their teachers, with their friends, and have that social interaction. So that is the goal, is to keep them in school and make sure that they're not having to quarantine or isolate or stay at home over and over and over again. So once local health officials feel that we can safely remove that mask mandate and keep our kids healthy and avoid having to quarantine or keep them out of school, then that's something that will be reviewed. But I think we also have to be graceful in how we look at that, because of course the COVID pandemic is changing week to week. What we're looking at right now, 3 weeks from now, things could look very different. And so we just have to do our best to take things one day at a time. Another question that can be submitted: what can be done about vaccine misinformation? The CDC actually has a very good website here where it talks a little bit about looking at good information versus bad information and how to help with, talking to people about vaccine misinformation. As someone who has conversations with vaccine hesitant individuals or people who are afraid, I think the most important thing that I can say to that is just be kind and be compassionate. We all come to making our decisions from a different place in life. We never know what challenges or what struggles someone has come to in their decision-making process. And so above all else, listen, be compassionate, and be thoughtful in how you respond, because of course there's a lot of strong emotions out there right now. And if you treat someone in a way that makes them feel like you're being condescending or judgmental, then there's not an opportunity to have a very good conversation. I mean, really, it's a principle that we can apply to having any conversation in life. And so I threw this quote up there that I really like. It is only with true love and compassion that we can begin to mend what is broken in the world. We're all out here just doing our best. Our teachers, our administrators, the staff at the schools, our students, our parents, we all just want, at the end of the day, what's best for our kids. And so if we can all just agree to use a little bit of grace and having those conversations, then I think we will help keep our school community safe and on a healthy path. Thank you very much for the opportunity to speak with you this evening. Thank you for watching. And of course, we're here to offer our advice and any guidance that we can moving forward. Again, thank you.